From the Toronto Star, I'm Saba Eitizaz, and this matters. It's been a difficult week. As we see protests playing out in the US and here at home demanding the sanctity of Black lives, there are questions about why Canada is reluctant to talk about race, systemic racism, and whether we truly are a colorblind society. And all this while the coronavirus stalks Black bodies, killing disproportionately.
Okay, I want everyone to please pay attention to this. It's important. Coronavirus is killing more African Americans than any other group of people in the United States.
Trends show that in the US and the UK, the pandemic is disproportionately hitting Black communities. You are twice as likely to get and twice as likely to die from COVID-19 if you're Black. In Canada, none of this is clear because race-based data has not been consistently collected during the pandemic. But what we do have is data from the H1N1 epidemic in Ontario, where someone was 10 times more likely to get infected if they were from the Black population. Claims of colorblind healthcare and approaches to the COVID-19 pandemic are concerning. The data from elsewhere, including the United States and the United Kingdom, sounds an alarm for Canada, and we're just beginning to talk about it. Leonard Rodriques is someone we should talk about. He was a Black personal support worker who died from COVID-19. He did not have proper personal protective equipment, and he was sent home from the hospital despite debilitating COVID-19 symptoms. His widow Dorothy wrote a letter asking for help and for immediate collection of race-based data so we can know what really happened and why. That letter was read out in Ontario's Parliament this week by opposition leader Andrea Horwath.
Dorothy said, and I quote, "Canada has gone too long covering their eyes to racial discrimination by refusing to collect data that challenges Canada's racial bias." And that would be the same right here in Ontario. We need a plan of action, she says. The Premier can answer this call today. Will the Premier acknowledge that hundreds of thousands of Ontarians face racial discrimination every day in this province and immediately issue an emergency order for the collection of race-based health data in Ontario?
Premier Doug Ford responded.
Of course, there's systemic racism in Ontario. There's systemic racism across this country. I know it exists, Mr. Speaker. What I don't know is the hardships faced by those communities.
In today's episode, we have the Star's science and technology reporter Kate Allen to talk about Leonard Rodriques. What do we know about how the virus is affecting racialized communities, why we don't have data, and what are the consequences? Because we might find out that the pandemic does discriminate, and so do we.
I can't breathe! I can't breathe! I can't breathe!
Thank you so much, Kate, for joining me today.
Thanks for having me.
So I want to start with data, what we are seeing so much of coming from the US and the UK about how Black and racialized communities are more vulnerable to COVID-19, while Toronto Public Health released geographical data last week, which we'll come to in about a minute. We have yet to see any based on race and other socioeconomic factors, but we do have important stories that show us how this pandemic might have exposed the systemic or institutional disparities or inequities in the country. You recently did a story on a personal support worker named Leonard Rodriques. Tell me more about him.
Yeah, Leonard was as you say, a personal support worker in Toronto. He worked for an agency that provides supports for people with disabilities to live independently in the community. And he had been a personal support worker for almost 30 years. And his family says that he loved his job. He loved helping people. He would go out of his way to help his clients. So, for example, he would, beyond just the regular course of care and support, he would bring tools from home to fix somebody's cupboard or patch a hole in their wall. Or once a client knocked their TV off their table and he went out to Walmart and got them a new TV. So he was just one of these people who sort of went above and beyond to help the people that he worked to support. And in early April, he found out that another worker had tested positive for COVID-19. And according to his family, he didn't have access to the appropriate personal protective equipment. And he had gone out to the dollar store and bought his own masks. And that's what he was working with. And pretty soon he felt this wave of exhaustion and he got tested and he had COVID-19 as well. So he obviously stopped working and was at home and was self-isolating as best he could. And his condition just kept getting worse and worse and worse. But he didn't want to go to the hospital until at a certain point his symptoms were so severe that his family insisted.
And he was reluctant to seek help at the hospital. You said he didn't want to go. Why is that? What did the family say?
Yeah, his family says that he just didn't trust hospitals. He didn't trust that as a Black man, he would receive equitable or appropriate care there. And that was based both on seeing reports from the US about just the disproportionate burden of COVID-19 on Black people and stories about the treatment of Black people who had COVID-19 in that country, but also on, his own personal experience and hearing stories just throughout his life from family and others about not receiving what they felt was appropriate care in the healthcare system as Black people.
And then things got worse to the point where he did have to go to the hospital, right? And they sent him back?
Yeah. So like I said, at a certain point, his symptoms were so bad that his family just insisted. They said his breathing was so ragged that he could barely speak more than a word without having to. They did an impression of his breathing that it was scary just to hear them do an impression of it. They said that if you had seen him on the street, you would have known he would have been so sick that you would have stopped and asked him, "Are you okay?" They said he was very, very ill. And so they just sort of put their foot down and said, we have to go to the hospital. You need care. So they called 911 and transferred them to telehealth, who told them to call 911, who eventually told them to just bring them to the hospital themselves. So they went to their closest hospital, which was Humber River Hospital. And because of COVID-19 restrictions, no visitors are allowed. So basically his wife, Dorothy, just had to drop him off at the doors of the hospital and she was sent home. And she went home thinking, oh my God, she was worried that he would be put on a ventilator or something like that because he was so ill and he would have nobody there to advocate for him that he would get appropriate treatment. And so she was at home cleaning his room. And a couple hours after she dropped him off, she heard the door open and Leonard stumbled into the house. And to everybody's absolute shock, he had been discharged with a prescription for antibiotics. And they were very upset that nobody had called them or told them to come pick him up. And he had to make his way home on his own in his condition.
What happened next?
So he continued to get worse. And 2 days later, he died in his home. And the family just had a horrible struggle even after that, where paramedics came and then they couldn't revive him. And they were told that somebody would come pick up Leonard's body and then nobody came. And the story, it goes on after that. But yeah, they really had an awful, awful time above and beyond losing their father and husband.
So these systemic hurdles, they didn't go away even after he passed on. Did you reach out to the hospital? What did they have to say in response to this? Why was he sent back?
Yeah, so the Humber River Hospital said that, first of all, they passed on their condolences on the news of his passing. And they said that when they discharge people, they discharge them with instructions to return if their symptoms get worse. They would not speak to the specific treatment of Leonard Rodriques. They can't comment on patients for patient confidentiality reasons. I asked them if they had any response to the family's overall fears about racial bias in the healthcare system, and do they have any specific policies or any practices that respond to that. And they said that they had an equity framework and anti-bias policies and a few other things. So that is what they said. But they didn't offer any specific info on what happened to Leonard Rodriques.
This is a devastating story that you covered, Kate, and it's hard to process. And while we're talking about this, we don't know if Rodriques' distrust of the healthcare system was based on a pattern of systemic racism or just a gut feeling he had. And we don't have the data to figure out which groups of people in Canada are being hit hardest by the virus beyond basic information. So have we created a blind spot when it comes to how public health authorities, policymakers, and individuals are able to combat the spread of this virus?
Yeah, so in the US, it's become quite clear that people of color and Black people in particular have much higher death rates in the pandemic and are suffering a much higher burden of illness in this pandemic. In Canada and in Ontario, we have not started to collect individual level race-based or socioeconomic data on COVID-19 cases. So we don't have the kind of data that would let us see if we have these problems. Health experts say they would be shocked if the same patterns didn't hold true here in Canada, but we just don't have the data to prove it. We haven't started collecting it.
And we're talking about data. Recently, Toronto Public Health did release maps on neighborhoods and communities most affected by COVID-19. Can you draw a picture for us? What does this data seem to indicate? Does it appear to show that some communities have much higher concentrations of COVID-19? And this is not just random clustering of infection pockets.
Yeah, so Toronto Public Health actually has started collecting individual level race-based and socioeconomic data on its own accord. They have about a month's worth of data, and they say they need more to start drawing conclusions from it. But they did release maps that show where in the city have the highest rates of COVID-19. And again, the burden of illness in the city is not randomly distributed. The neighborhoods that have the highest concentration of COVID-19 tend to be much lower income, have a higher percentage of racialized people, have higher percentages of immigrants, and they are not the same as the neighborhoods that have the least COVID-19 cases.
From what I'm seeing, the 5 most affected neighborhoods also have more than double the percentage of visible minorities compared to the 5 least affected. Did you observe that?
Yeah, so when we collected census data on the 5 most affected neighborhoods versus the 5 least affected neighborhoods, the 5 most affected neighborhoods had more than double the percentage of visible minorities than the 5 least affected. But these are area-based measures. So what is happening is Toronto Public Health is releasing these analyses based on postal codes, the postal codes of where people with COVID-19 live. But as everybody knows from their own neighborhoods are not homogenous. So it's one thing to say a neighborhood is, 27% visible minorities or 86% visible minorities. It doesn't tell you the kind of specific granular information that health experts say we need to really start digging into the where and why of the disproportionate impacts of the pandemic.
We've often have actually heard recently, in fact, from provincial health officials that Canada is a colorblind society and that we shouldn't expect that race-based data was necessary. What would the data tell us and why is it actually necessary, do you think?
It's sort of been a saga. I mean, the whole race-based data in Canada has been a saga long before the pandemic hit. But since COVID-19 showed up, at first, the chief medical officer of health for Ontario said that race-based data wasn't necessary. I can't remember the exact quote, but it was something to the effect of, we treat all people equally, which was sort of a baffling statement to health experts because it sort of glosses over the potential problems here. And then about a month later, the province reversed course and said it would collect race-based data and occupational data and other sort of individual level socioeconomic data, but it has yet to start doing that. And it's been over a month since they said they would. And so the province, when I last checked in with them, said, this data is very important to understand the impacts of COVID-19 on vulnerable populations. We do need this data. We are working with our stakeholders to figure out how best to collect it and also with a view to privacy. So they say they're still doing it. They just haven't started yet.
And it seems like a debate or an issue to address a little bit late in the game when they're just starting to talk about this and what the methodology will be. And I would like to emphasize this. You spoke to experts about this. How essential would data like this be in fighting the pandemic and trying to find out its impact on the most vulnerable who might be falling through the cracks in the healthcare system?
Health experts say it is absolutely essential. And, we already know based on this neighborhood data that COVID-19 is disproportionately affecting some neighborhoods with higher representation of low-income people, racialized people. But we don't have the type of data that could specifically inform policies. So, for example, if we find out that just like the US, Black Canadians are dying of COVID-19 at higher rates than white Canadians, that is really, really, really important information to help tailor your response. And I should be very clear about this. It's not that people of color have, different lungs or something that would predispose them to severe outcomes or death from COVID-19. It is almost certainly the way that we have structured our society. So as one health researcher put it to me, we have structured our society in a way that is fundamentally unfair. So a lot of the essential workers, the people who have been put more at risk because they are on the front lines of the pandemic, these jobs are more likely to be held by racialized people, and they are low-paying jobs. So the way we have structured the labor force, for example, is likely to be creating more risk for some people. But we don't have that type of granular information because we haven't started collecting occupational data. We don't know specifically what types of jobs are putting people most at risk. And if you knew that, you could make sure that, say, grocery workers or personal support workers, definitely, but all kinds of occupations that are more at risk, we could tailor responses so that those people have better protections. But we can't tailor those responses until we have the data to show who is more at risk and why.
And you mentioned the US and the UK, and I want to draw some parallels here. In the US, legislators, civic advocates, and medical professionals have said that the information is needed to ensure that Black people and other people of color have equal access to testing and treatment, and also to help to develop a public health strategy to protect those who are more vulnerable. And we saw there was pressure on the US to do so, and then it did release that data. Why is it that Canada has come to this at this point? Why doesn't Canada release daily race and ethnicity data on coronavirus testing, patients, and their health outcomes? Does this say something about our sort of reluctance to engage on this issue at a racial level?
Health experts definitely think so. As I mentioned, this problem of a lack of collection or even an unwillingness to collect race-based data predates the pandemic. We have much, much, much less information on disparities in our healthcare system compared to the US. Although it's also important to note that just because you have the data doesn't mean you're necessarily going to make more equitable policies. So the US has this data in spades, and they still have a very, very unequal, discriminatory healthcare system. So it's not enough just to collect the data, but it's a start. Yeah, I mean, I think one thing that one researcher mentioned to me is that there seems to be a sort of misconception that because we have a universal healthcare system, everybody gets equal treatment. And that is not the case. I mean, even just the last time that we had a pandemic, which was the H1N1 influenza pandemic of 2009, again, nobody was collecting individual level race-based or socioeconomic data during that pandemic, but some researchers went out, basically used a phone bank to call back every single person who had been tested for H1N1 in Ontario. And they found that South Asian, and especially Black people were much more likely to get H1N1 than white people. So we know that when we have the data, we find these disparities, but we don't know until we look, right? As researchers keep telling me, these disparities are there. We just don't know exactly the nature of them until we collect this data. And so aside from this misconception that a universal healthcare system equals universal treatment, I think as you're sort of getting at here, I think Canadians also have this impression that racial injustice is something that the States suffers from, but Canada is immune to. I mean, Doug Ford said something to that effect, that thank God we don't have these, I think he called them systemic roots here in Canada. And, you know, I mean, I don't need to cite experts to tell you that that's not true.
And the perception of racial bias in our medical system has been documented and written about and talked about elsewhere, which doesn't necessarily mean a restriction of access to healthcare, but could also mean how someone is treated once they're in the health system. And you've just recently covered this terrible tragedy with the Rodriques family. What have you observed in your reporting? Did the family express similar concerns?
Yeah, so the Rodriques family doesn't know whether race played a role in why Leonard Rodriques was turned away from the hospital. And they'll never know. It's not like if they got his medical chart, it would say, you know, I'm not treating this person because they're Black. These are patterns that tend to show up broadly rather than, you know, it's usually not a specific racist doctor who doesn't want to treat Black people. It's unconscious bias that comes through in various ways. But again, we don't have the same type of data in Canada that they have in the US that shows these patterns emerging over and over and over again in many different facets of the healthcare system. For the Rodriques family, it just accelerated their fears that they wouldn't be treated equally at the hospital. And that was extremely difficult for them, on top of losing their husband and father, to sort of have to wrestle with these questions of feeling like his race played a role, but not having any specific proof to hang their hat on. I mean, it's very difficult.
I just wanted to bring up a medical point here. A lot of medical experts are talking about certain underlying health conditions that Black communities might have faced that could lead to more vulnerability to this disease. But there never has been a pandemic that brought those disparities so vividly into focus. They're talking about how African Americans have higher rates of diabetes, heart disease, and lung disease, and that is well documented. But do you think there are socioeconomic conditions and even history that kind of plays a role in these underlying conditions, if you've talked to any medical experts about that?
Yeah, so the types of underlying health conditions that can make COVID-19 worse and can put you at higher risk of death, the higher burden of those conditions in Black communities and other people of color, that itself is influenced by discrimination and in longstanding inequitable access to healthcare and other forms of discrimination, including poverty. Poverty is itself a determinant of health.
And I want to finish this with Dorothy and Leonard Rodriques and their story. And I've read your piece. You speak a lot about their struggles and how they chose Canada as their home to begin their life together and what they went through. Did Leonard's death make Dorothy question that belief or that certainty? You spoke to her. What did she have to say?
Yeah, so they decided to settle in Canada, and they made that decision because they thought that them and their children, that they would all have better opportunities here. But Leonard's death and everything that they've gone through has made Dorothy question that decision and whether she was right that they would have better opportunities here. You know, Leonard, as she pointed out, spent his entire life helping other people. And she did too. She worked as a personal support worker as well for a long time. And she feels like they gave so much to this country and then they just got, as she put it, kicked in the teeth. And something she said to me that I definitely was haunted by is that she feels like a stranger in this land.
Thank you so much for talking to me, Kate.
Thank you for having me.
That was the Toronto Star's science and technology reporter, Kate Allen. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Rajlu Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by SoCalled, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.